What are the 7 danger signs of the thyroid, of hyperthyroidism? In this video, I'm going to tell you about the symptoms that show up in your body when you have too much T3 and T4 hormones produced by your thyroid. Hyperthyroidism is less common than hypothyroidism, where the thyroid doesn't create these hormones like it should. It produces less hormones. So lots of folks don't know the warning signs for hyperthyroidism. There isn't much out there on the internet about this. Since you guys keep asking for this on my channel, the topic will be hyperthyroidism. There are 7 signs I want you to look out for. So what triggers it? Why does hyperthyroidism happen? There are 2 key reasons. These account for over 95% of hyperthyroidism cases. First and foremost is an autoimmune condition. When your body starts attacking the thyroid with high levels of something called TRAbI, it amplifies the thyroid's hormone production. This is the most common cause. This type of autoimmune disorder also goes by the name Graves' disease. So, Graves' disease and autoimmune hyperthyroidism are the same thing. The other frequent but less common cause is when you have a nodule that produces thyroid hormone. This nodule is called a hot nodule or autonomous nodule. It could be one or even multiple nodules that produce an excess of thyroid hormone. So that's why hyperthyroidism happens. There are other causes, but they're pretty rare. We usually end up identifying one of these 2 types. And what are the 7 danger signs of hyperthyroidism? Number 1, and I want to really emphasize this one, is anxiety disorder, or when someone who was already anxious gets worse, or someone who was in control suddenly becomes anxious again. Even people having anxiety disorders for the first time, because the thyroid hormones also affect the central nervous system. So when the thyroid makes too much T3 and T4, you can experience changes, even leading to anxiety disorder. And why did I say I wanted to highlight number 1 here? Because every week I see patients who have been trying to manage their anxiety disorder for a long time. So they've probably already seen other doctors but still feeling awful. Then we check their thyroid and find out they have hyperthyroidism. This kind of anxiety won't get better unless you treat the underlying thyroid issue. So whenever you deal with anxiety disorders, it's super important to look at the thyroid too, because it's a common factor. If anyone watching has a thyroid issue, I'm curious. When did you find out you also had anxiety? Were there any changes? Anxiety can even make existing depression worse, or actually cause depression, which is another symptom. But right now I'm focusing on anxiety. Number 2 is weight loss. Wait, didn't you hear that thyroid problems make you lose weight? That's totally true. Because with hyperthyroidism, weight loss is one of the symptoms. You can lose around 15 to 20% of your weight. It really happens because the thyroid hormones play a big part in our metabolism. So if you have a lot of T3 and T4, your metabolism will get messed up. And one of the results, which is actually pretty common, is weight loss. So no, it's not a myth. Thyroid problems, specifically hyperthyroidism, can actually make you lose weight, and it happens fairly often in real life situations. So if you're randomly losing weight and you didn't change your diet or start working out or anything, you absolutely need to check to see if your thyroid function is normal. The 3rd dangerous sign of hyperthyroidism is bone changes, like fractures from minor falls or even osteoporosis. This is because excess thyroid hormones can make your bones lose minerals. Just to simplify, it basically makes your bones weaker when the hormones are overboard. So if you've got hyperthyroidism, it's crucial to check if anything is wrong with your bones. Quite often I diagnose someone with hyperthyroidism and they've already developed osteoporosis or have changes in their bone density. This information is super important for knowing what precautions to take and for other treatments. On the flip side, if you've been diagnosed with osteoporosis or have had a minor fracture, it's also mandatory to check your thyroid. Alright, before I move on to the 4th point, let's set a likes goal. I know you guys want me to set a likes goal. Everyone always comments, hey, you forgot to set the 10,000 likes goal. So 10,000 likes is our goal, okay? When we reach that, the system knows that the video is worth sharing, and so they do share the info. Number 4, chronic diarrhea. When you get infected or maybe eat something dodgy, how long does the diarrhea last? 3-4 days is the usual, but when we have an overproduction of diarrhea, an overactive thyroid, it also creates some GI issues. So chronic diarrhea, oftentimes the patient has been dealing with it for 2-3 months. They're having diarrhea. Some even start showing signs of nutritional deficiencies, because when you've got diarrhea for this long, these deficiencies start to develop. So with chronic diarrhea, you should really get your thyroid checked out. And this stands out because oftentimes this is the symptom that pushes the patient to seek help. And you won't always have all these 7 symptoms. Maybe just 1, 2, sometimes 3 symptoms suggest something's up with your thyroid. But I once had a patient whose only symptom was chronic diarrhea. So it's possible. It's important to note this because there's this notion that in order to have a problem with your thyroid, you gotta have all these symptoms. But actually in real life, it's not like that. Number 5, arrhythmias, because our heart also has receptors for thyroid hormones. What's the normal heart rate? From 60 to 100. Now, with hyperthyroidism, often their resting heart rate, when they're just sitting still, goes up to 110, 115, 120, 125. So when we have a fast heart rate, an accelerated heartbeat at rest, you should get your thyroid checked out. And the symptom I mentioned before, the critical symptom, is arrhythmia, like atrial fibrillation. In older folks, it's quite common to have what's known as apathetic hyperthyroidism. A particular type of hyperthyroidism, it's a different presentation. And sometimes the first symptom in older people is arrhythmia. They start with atrial fibrillation. The heart starts beating in a weird way, with irregular beats. So, we run tests, try to find the cause, and there it is, a thyroid disorder, hyperthyroidism. So, when the heart is beating faster or there's arrhythmia like atrial fibrillation, you should also get the thyroid checked out. Moving on to number 6, high blood pressure. Did you know that the good old thyroid also has a big impact on our blood pressure? This is because the hormones T3 and T4 play a big part in relaxing our blood vessels. So you see, if you have an increase in these hormones T3 and T4, you could end up with this thing called systolic hypertension. That's when your blood pressure goes up due to an excess of thyroid hormones. To clarify a bit about the blood pressure bit, specifically in hyperthyroidism, there's this thing called systolic hypertension. When the first number starts to rise quite a bit, like say you're getting readings like 17/9 or 16/8, that's a big clue that points towards something being off with your thyroid and might need investigation. It's pretty common for high blood pressure to be linked with excess thyroid hormones. This is so important to look into because this type of blood pressure change due to excess thyroid hormones can hardly be controlled just by taking high blood pressure meds unless you deal with the root cause, which is the thyroid disorder. So whenever you are diagnosed with high blood pressure, it might be one of the best tips from this video to have your thyroid hormones checked, because high blood pressure is pretty common and a lot of folks can't control it and don't know why their blood pressure is rising. So looking into your thyroid functioning should always be part of the plan in these cases. And number 7, hair loss. Now you might be thinking, hold up, hair loss? That's a symptom to be worried about? I'm putting this symptom in here because hair loss often comes before the more dangerous symptoms like changes in blood pressure and heart rhythm. So it's important to keep this in mind. Thyroid disorders can lead to hair loss, and studies show that the sooner you identify and treat the thyroid issue, the better your chances of successful treatment. So, hair loss could also be caused by hyperthyroidism linked to the thyroid. Based on this video, on a scale of 0 to 10, what would you rate it? If it's a 10, I can make more videos like this one. What city are you watching this in? Which part of the world are you in? I'm doing this from Porto Alegre. Let me know in the comments. Next, I have a video suggestion for you. It's about the 7 best foods in the world. If you like learning about health, I think you're gonna like this video. Catch you later.